They just are focused in their one region. That really isn't the best way to treat cancer or any disease for that matter, because you need to treat the whole body and not just focus on one therapeutic to treat one little spot of the body.
You're listening to the Integrative Medical Podcast with Dr. Jake, a licensed naturopathic doctor who will show you how to tap into your body's natural ability to heal your health issue and improve your symptoms quickly without harmful drugs or devastating surgeries. So pour some tea, get comfortable where you are, and enjoy this healing episode.
Hey. Hi, everyone. I'm Owen Video, and I'm here with Dr. Jake, and today we're talking about the conventional versus the integrative approach to treating cancer.
That's right. If you have cancer, you know someone that has cancer, if you go to the conventional doctor without seeing an integrative doctor, you might make a big mistake. The reason for that is, let's say you just do the treatments that they recommend. You just do the chemotherapy, you do the radiation or other therapies they recommend. You might be making a big mistake because you might be missing out on decreasing the side effects of that therapy they're prescribing, or not being able to get the same benefit without the integrative therapies. Or you might be missing out on a therapy that might not have the side effects that the therapy they're prescribing, but still has the same success or maybe better success.
You know, those are all phenomenal points. And that was exactly, my experience as a stage 4 cancer patient under Dr. Jake's care. I went the conventional route. I did everything that they told me to do, and it came back, and it came back with a vengeance. I hope that you get a lot out of our episode today, because I know that we're both really passionate about it. Doc, let's kind of jump right in by defining, what is integrative care, and how does that sort of differ from like adjunct care or alternative care and some of these other terms that we hear around the industry?
They're slightly different, maybe slightly the same too. What I consider integrative care is you can combine both the conventional and the alternative side of medicine. It doesn't mean you have to pick one or the other. You can combine the two. And I think if you combine the two, you could even have the best success, because conventional medicine does have some good things to offer, and integrative medicine has a lot of great things to offer too. And when you combine those two together, they work really well. But the big difference is with integrative, we understand the need for some drug-based therapies, but we also understand the need for diet, nutrition, herbs, mental health, and many other aspects that conventional oncologists don't dive into. They just prescribe the chemo or radiation and don't dive into your general health. We work on really identifying what could have been potentially the cause of the cancer and work in treating that cause and eliminating that cause, and then attacking the cancer at the same time.
Why do you think conventional doctors don't dive into what seems to be a pretty obvious thing?
It's just their training, Owen. The reason for that is they just learn about specifically, let's say a doctor that does chemo. It's an oncologist that does chemotherapy. His postgraduate training is in chemotherapy, and that all he focuses in, that's his specialty, and that's his area. Then we have the radiation oncologist, that's all he focuses on. Then we have the surgery oncologist, that's what they focus on. Yeah. And they receive very little training on anything about diet, little training about herbs, and all the mental health stuff. They just are focused in their one region. That really isn't the best way to treat cancer or any disease for that matter, because you need to treat the whole body and not just focus on one therapeutic to treat one little spot of the body.
What you just said, I feel was like the big difference maker in my treatment. We're going to get to that. But first, I wanted to ask, how do you judge if something is effective or not? Are we looking at a quality of life thing? Are we looking at whether or not it eliminated cancer entirely, or just if they're alive in 2 years? Like you mentioned, integrative can be very successful. What does success mean in this kind of case?
I mean, it could be all over the place what success means. I mean, for me to actually feel like it's successful with a stage 1 through 3 patient, I want their cancer markers to be really low and the cancer not to be really there anymore for me to really see it as a success. Now, a stage 4 cancer patient and they have cancer all over their body, I might think that it's a great success if we are able to maintain the cancer where it's at and keeping it from growing and able to maintain a really great quality of life. Now, is it successful if we take it all away? Awesome. But I see it as a fantastic success if we're able to keep the cancer at bay, keep it from growing, and give them a great quality of life and more years.
Awesome. As a naturopathic medical doctor, have you seen the integrative approach provide a better result on average? And do you have any examples of something that you could share with our audience?
I would say majority of my patients do get success. Unfortunately, most of the patients that come to me in stage 4. I wish they came into me earlier because we're going to have much greater success in the stage 1 through 3s because the cancer hasn't progressed as much.
Right.
But let's talk about a stage 2B patient, breast cancer patient that came to me. What I recommend, she came into me, we talked, we discussed what was going on with her. We ordered some detailed laboratory work to find out what type of treatments we needed to do for her. We formulated a treatment plan for her. We did some high-dose IV vitamin C, artemisinin. We did some dietary ketogenic diet, plant-based stuff with her, and many other therapeutics with her. I also did recommend that she got the tumor surgically removed from her breast, and she is 5 years out now, and there's no cancer at all. There's nothing there.
Oh, that's wonderful. I love to hear that someone is 5 years out, 10 years out with no more cancer in their body. Go through this step by step. We compare conventional versus integrative approaches to treating cancer. But remember, those of you listening, this is a podcast. It really shouldn't replace sound medical advice.
That's right, Owen. If you have cancer or someone you know has cancer and they're wanting to go dive into the integrative approach, visit integrativemedica.com, find our phone number, and give our doctors a call today.
So let's start at the very beginning, Dr. Jake. What is cancer? And give us maybe the conventional medicine approach or answer, and then the integrative approach. So what is cancer?
In conventional medicine, cancer, and in integrative medicine, it is a tumor, or not necessarily always a tumor depending on the cancer, right? But it's a mutation that occurs inside the cell that doesn't have a turn off switch. So it starts to grow and grow and grow and doesn't ever stop growing. And it grows faster than our immune system is able to take care of it. In conventional medicine, they think there's really nothing you can do to prevent cancer. It's genetic, and you're just going to have to deal with it when it comes. In integrative medicine, we do a lot of preventative stuff to help prevent cancer from coming. Maybe you have a sibling or a mom or a dad or someone close to you that might have breast cancer, prostate cancer, or other type of cancer. There's definitely a lot of things you can do to go after it. And in conventional realm, they're not going to do that. In alternative or integrative, they will dive into that. Difference in the integrative medicine is we really see that cancer could potentially have a genetic component, but also we see that there's all these different causes that could be causing the cancer. Like there's a big one is, I like the metabolic approach to cancer, is there's this imbalance of your metabolism. There could also be stress that may be causing the cancer. You're not feeling good about yourself, or all kinds of things. I'm not going to dive into that really in deep detail here, but that's the big differences between the two.
Yeah, the thing that really stood out for me is the genetic approach, like there's nothing you can do, versus the metabolic approach, which impacts the genes, right? And their mass reproduction. But I've always sort of wondered about it, like especially in my own case, what caused the tumors? Was it like they just started, the cells just started deforming, or does trauma affect that, or surgeries? You said stress, like, so we know what cancer is, but what like causes those first million cells to actually act this way?
It could be all kinds of things. Stress, mental stress is probably the biggest one I see. They could be under a ton of stress, which then produces a ton of cortisol production. When you have too much cortisol production, that decreases your immune system. So we're always making cancer cells right now. I have cancer cells in my body. They're always being formed, and our immune systems are gobbling it up and finding that these cells are mutated and we need to take these out. But when you get really stressed, your immune system's suppressed, so it's not able to really fight it as well. And then the cancer cells just start to replicate and replicate and replicate. I mean, you could be exposed to maybe a toxic exposure, let's say a pesticide or herbicide or some type of heavy metal, which then can cause damage to the cells and lead to mutation. And again, the reason why there's too much toxin, or maybe your immune system's suppressed, and that's why the cancer formed.
Fantastic. You got cancer now. You got a tumor now. How do you shrink or debulk that tumor? What's the conventional answer? What's the integrative answer?
So the conventional answer is that many times they're going to perform surgery on it and get it out of there. Or if it's too large, they're going to do some chemotherapy to try to shrink it a little bit, so they're able to get more clean margins with the surgery. So or they might do radiation. So it's either many times both chemo, radiation, surgery. It's usually surgery if it's small enough, or it's chemo and then surgery. That's usually what their treatment regimen is in a nutshell, going after the tumor. The integrative approach is they are going to look at, okay, what's potentially causing your issue? Let's first address that. Let's take that out so we don't have this continuum bombardment of more cancer cells being formed. And then we talk about, let's improve how your body works and how it functions, improves its metabolism, improve its mitochondrial function. And then let's work on killing off those cells by boosting the immune system or using some therapies that are cytotoxic to the cancer cells.
Is there like a time frame difference? Like, I don't know, the conventional approach works faster, but it's less effective. Metabolic might take longer. Integrative might take longer. Is there any truth to that? What do you see in terms of like time to recovery?
In general, I would say probably the integrative approach is going to take longer to show things on your laboratory work or show things on your imaging, because we're working with your body to take care of that cancer, and we're doing it's more a gentle approach, but it's still powerful. So obviously, if you just go in there and you cut out the tumor is going to be gone, right? So it's going to show that you have no more tumor there. You're going to do imaging and the tumor is gone. I'm not saying that surgery is absolutely bad. I do recommend surgery in my patients, but then we do treatments to help eliminate all those other circulating cells that might be going on instead of just doing chemotherapy. Or if someone decides to do chemotherapy, we combine treatments that help improve the chemotherapy and reduce the side effects, and then increase the immune system, improve the body function so they can work really well together.
That is so key. There's so much I want to dig into right there, because no one in the hospital ever told me about circulating tumor cells or cancer stem cells. Now, that doesn't mean that they don't approach them. Does conventional medicine even approach those things?
Not really. They don't go after cancer stem cells. They go after just get your numbers down. And if your numbers are down, they're happy. And then they monitor you. Let's say that you do a total mastectomy, right?
Yeah.
You're not going to get breast cancer again because your breasts are gone. So obviously you're not going to get breast cancer, but you could get cancer somewhere else because you have stem cells that can turn into some other cell. You could get colon cancer or pancreatic cancer or brain cancer after you get cured, so to speak, from breast cancer because of the total mastectomy.
And that's because of, let's define those terms for anyone who doesn't know. What's a circulating tumor cell?
So it's a cell that's just circulating in the bloodstream. It could either be let's say you have breast cancer and you have breast cancer circulating around, and then that breast cancer can circulate around and go somewhere else. Like it could go to your liver, or it could go to your lymph nodes, or it could go to your ovaries or your uterus. It's a tumor that's circulating around in your body all the time.
It's in your blood.
So you need to do treatments that are systemic, not just local.
Yeah. Okay. And is that different than a stem cell, a cancer stem cell? Or are they the same?
Yeah. So a circulating tumor cell usually has a certain name. It's a breast cancer cell or prostate cancer cell, etc. A stem cell can be turned into any type of cell. So you could have a stem cell circulating, cancer cell circulating around, and you have prostate cancer, but then you get colon cancer.
Wow.
Which is a completely different cell line. So you can have several different cancers at the same time sometimes. Or you get the prostate cancer taken care of, and then you just show up later with colon cancer, not prostate cancer.
Man, that is so overwhelming. But let's talk about the role of chemotherapy, radiation, and surgery in conventional and in integrative. Because it sounds like what you're saying is that you could get this surgery, let's say the double mastectomy, and then you've got let's say 6 cycles of chemotherapy, but then the cancer could come back. So what is the role of chemotherapy, radiation, and surgery? Is it a cure-all as it fixed to conventional, or maybe it sometimes work? Like, what's the conventional thought? And then what's the integrative position on chemo, radiation, and surgery?
Really, it's all about terminology, really. I mean, with a lot of cancers, they call it a supposed cure if you're cancer-free for 5 years or 10 years, depending on the cancer. Most people think that cancer-free means never cancer coming back, right? It's done. And it's really deceiving. In my mind, I think it's deceiving. When I learned that when I was in medical school, that you're calling it a cure, I think that's not the right term for it, because that's 5 to 10 years of the cancer not coming back. And there's probably going to be some cancer that's going to come back that you're going to have to take care of.
Is the recurrence rate higher in chemo and radiation? Is it lower? Do you know anything about that?
I know the recurrence rate is very high in the conventional realm, because I think the biggest reason why that happens is because they eliminate those cancer cells, but then they don't take care of the body, or what I call the terrain of the body. They destroy the body. And obviously, if you destroy the immune system or destroy how the cells work, there's more mutations that are going to happen, and you're going to get cancer in other cancers sometime down the road.
Yeah, when I told my family that I'm going to do integrative care, I was very specific with the term integrative care. But I also sent them a picture of sort of like a witch doctor to kind of make them laugh, like holding branches and things like this. It's like the monkey from Lion King.
I kind of look like a witch. It's true.
You do. And you do have that drum in your office.
Yeah.
I've always wondered about that. But, I do that to make them laugh. But I think that when the average person hears like integrative or alternative, they think that you're anti-chemo and anti-surgery. And maybe at some level we are. But what is the integrative opinion on those therapies?
The integrative opinion is that they could be beneficial. It just depends on their success rates. We want to look at, okay, we have a lot of data because tons of people are getting chemotherapy and we track it really well. So we have good data of how well does it work? Like if you have a leukemia, for example, certain types of leukemia could have a 95% success rate with the chemotherapy. So I'm like, yeah, we probably should do chemotherapy in that case. It has a really high success rate. Let's do other things on top of that to reduce the side effect profile and improve how your body works while we're doing that chemotherapy agent. Now, I'm not a huge fan of chemotherapy for end-stage cancer patients that the studies are very mixed and likely not going to do anything at all and likely going to decrease the quality of life, and their last few months of life are just throwing up, being tired, and not functioning very well. Yeah. Instead, they could be feeling awesome until the last week before they die.
Yeah, so there's a quality of life there thing. So what are some of the integrative therapies for reducing the side effects from chemo or for rebuilding the body after chemo? Run us through some of those things.
So it all depends on what type of chemotherapy you're having. Quercetin can be good for a lot of different chemotherapies. Turmeric is one you don't want to do with chemotherapy, even though that's like probably the most popular herb out there to take. That's one we kind of don't want to do.
Why is that?
Because it interferes with the oxidative stress of the chemotherapy and it can decrease the effect of it. And there's research showing there's potential harm there. But there's a lot of debate in the integrative realm there is you just have to get knowledgeable about it and you can use it. And sometimes it could be really beneficial. But in general, you want to stay away from turmeric. Glutamine can be really great to decrease the neuropathy that happens and the mucositis that happens from chemotherapy. So those are just some quick ones. Can't dive into all of them.
Yeah. What about fasting during chemotherapy?
Yeah, that's a great one. So that's amazing to do before chemo. So you could be really aggressive and you could fast 3 days. That's a water fast before you do chemo and then a day after you do chemo. So it's like a 4-day regimen, 4 to 5 day regimen, or good research showing you fast the day before, the day of, and the day after. Yeah. And that has great success. And that increases the sensitivity of the cells to the chemotherapy.
Plus, there's a value in autophagy, right? Because when you've been fasting for 24 hours, your body's in autophagy, and it's actually cleaning up those bad cells. That's the regimen that I was on. Is that you guys prescribed to me was the day before, the day of, and the day after. And my chemotherapy has been 0 nausea. And not only that, because it's only 3 days, like I'm still pretty energetic for the first 2 days. I'm not playing tennis or anything, but even the sort of the fatigue from fasting is way better than the nausea from chemo. And so we love that. What about the role of diet? Anytime I mention diet to sort of like a mainstream person who watches the news, that, all of a sudden you're a witch doctor. You actually believe that what you eat can affect your health. What role does diet play in beating back cancer or in fighting cancer?
Being a witch doctor and thinking diet helps is just crazy in my mind. I don't understand how people still believe that diet doesn't have any effect on our health. We know we have diabetes and cardiovascular disease from eating poor diet. Why wouldn't it be related to cancer or other medical conditions? It just doesn't make sense to me. But diet has a big piece. Cancer cells love sugar. So if you're pounding sugar all the time, you're just feeding the cancer cells. They're just sitting there with the fork and the knife ready for growing and eating tons of food when you're giving them tons of sugar.
You go into the chemotherapy room, they give you for free Snickers, Butterfingers, Twix. They give you those creamers. They give you sodas, all for free. And it's just like, how did the doctor, I'm getting emotional on this one. Continue. What are some of the other diet things that are happening with cancer?
Going on that point, I have no idea why they do that. I guess they want to make you feel good psychologically when you're doing that, but it's the worst thing you could do. Like if you go to other integrative clinics that do chemotherapy on the side, they give you great nutritious food
Yeah.
along with their chemotherapy. But yeah, so what we want to do is we want to flood the system with nutrients, which is we want to eat tons of vegetables, a little bit of fruit, and we want really high fat, good quality fat, not bad quality fat, not animal fat, not a ton of butter, not a ton of lard, and not a lot of vegetable oils and things like that. We want like olive oil, coconut oil, avocado oil, these type of things. We eat a lot of that, nuts and seeds, to really keep your fat content up, because cancer cells don't love fat. They love sugar. So if you change your metabolism to feed it on fat instead of feeding on sugar, you don't have those spikes. And the cancer cells are like, hey, I want more food. And they starve when you follow a diet like that.
Now you're talking about a ketogenic diet, essentially, or high fat, low carbohydrate.
Well, let's talk about that. Ketogenic is different than, I love plant-based ketogenic. Now, if you can modify it a little bit and eat some meat, I'm okay with that. But it's best if you do plant-based, because there are growth factors in meat that can grow the cancer cells.
Even in like grass-fed stuff?
That is better. Don't
Okay.
get me wrong. I like that. But it does still have some growth factors in there that can stimulate cancer growth. Now, if you do it in moderation, I'm happy.
Yeah.
But if you eat tons of it, I'm not.
He says that, folks, and he's looking at me because I started vegan keto. I was doing vegan keto, had tremendous results. And then I started going like more towards the keto side. But I do limit my protein tremendously. Like it's mostly like right now I'm at about 88% fat during the day. And I pride myself. I use a Keto Mojo to track my fat. I use Carb Manager, track the foods. Why does that work? Why does a ketogenic diet or a high fat diet work?
In a nutshell, is you're not feeding the cancer cells with sugar. You're changing your body to a ketotic state, meaning your body is dependent upon fat for energy now. And then you're not going to have these big spikes of your blood sugar, and your blood sugar is going to be really low. And that's going to starve the cancer cells piece. They're not going to feed on that fat. They're just getting this little baby amount of sugar every once in a while. Instead of when you eat a normal diet with high in sugar, you're going to be feeding it constantly all the time, and you're going to have these huge spikes, that's going to grow much more readily than anything else.
Yeah, that's crazy. And I cut sugar immediately, and I've had maybe not even any more than 4 carbs over the last 4 carbs a day for like 30 days. I pride myself on keeping that carb down. So I want to motivate anyone listening, because we hear a lot of people say like, oh, I could never do that. Oh, I could never give up my dinner rolls, or I could never give up my evening ice cream. But it's like, well, then just tell your grandkids goodbye then, I guess. You know what I mean? Like, it's just so worth just giving that stuff up until you get into a healed state, that I think is important. Everyone can do this. Anyone can go ketogenic. And I've had nothing but like nuts and berries or nuts and fats today, and I feel great. Let's talk a little bit about supplements then, because you've mentioned quercetin, you've mentioned some other things. What role does supplements play in a conventional approach versus an integrative approach?
So in the conventional approach, supplements are non-existent. They're not going to prescribe anything like that at all. They're going to give you chemo and radiation and surgery, and not discuss about all these other herbs and nutrients that have great research to be beneficial with the chemo or radiation, or stand alone, like mistletoe, for example.
Yeah.
It's not just the kissing stuff. It actually is really great against cancer. It probably is one of the herbs that have more research on it than anywhere in the world. I mean, it is the mainstream medicine in Germany and Switzerland, and I believe in France, and many places in Europe, because it has so much research to be so beneficial with chemo. And it works by itself too. It boosts the immune system to go after the cancer cells, and also has constituents in it that are directly cytotoxic, meaning it kills the cancer cells. So that's one. Turmeric's really great. It has so many different mechanisms of how it functions with killing off cancer cells. I love quercetin. I love resveratrol. I love getting your vitamin D up, keeping your vitamin D at 60 to 80 to 100 on your blood work.
Yeah, talk about resveratrol, because I hear that, and I'm taking it myself, but I also see it around a lot. What does that do?
So it depends on the cancer, and I like to combine it with turmeric. They work really well together, but it has cytotoxic properties, and increases your mitochondrial function and decreases inflammation. So it helps your body work better, but then it also goes after the cancer cells. So I love it, just like turmeric does.
Now, I take a bunch of stuff that is I think it's anti-angiogenic is what. Can you talk a little bit about like pomegranate seed and angiogenesis and what all that is?
Angiogenesis is cancer growth, right? So it's going to keep the cancer growing, or the blood vessels start going out. So there's a lot of different herbs that can decrease that action that happens, like the pomegranate seeds. Turmeric does that too, and so does resveratrol.
Okay.
So does quercetin.
Is there a limit to how many supplements you can take? We're assuming it's an all-natural supplement. We're assuming it's an herb that comes from the ground without additives. But is there like a limit, or can you just pile those on?
Herbs can cause side effects too. I mean, they are more gentle than a medication because they're not usually blocking a certain reaction in your body. They have a lot of different constituents in them. So like sometimes it could be pro-inflammatory and anti-inflammatory. So they have more a modulatory effect to them. But you can take too much and you can harm your body if you take too much of certain herbs or nutrients. So you really need to go to the doctor that knows about the research and how to prescribe them to really be successful and not cause any side effects.
Speaking of success, let's talk about success rates with conventional and success rates with integrative. And obviously, you know, we don't want to quote you down to the numbers, but what can you tell us about the success rates in the conventional sphere where you're like getting pounded with chemo and radio? And then what are the success rates like in the integrative side?
It all depends on the staging of the cancer. Stage 1 and 2, conventional has great success many times, depends on the cancer. And integrative medicine does really great too. Both do a good job. Conventional route is going to kind of destroy your body and you're going to have to regain your body's function again. And in the integrative approach, you're just going to feel really great when you're doing that.
Yeah.
Stage 4, in the conventional realm, there really isn't a lot of options. That's really why I see so many stage 4 patients, because in the conventional route, they don't really know what to do. They're just going to give you some things to kind of slow the process down a little bit, and that's about it. In the integrative approach, my main goal is we're going to make you feel awesome. We're going to make you feel great. We're going to keep that cancer at bay and decrease that cancer. Success rates specifically, it depends on the clinic. It depends on what treatments are being done to really know exactly how well it's going to be. Now, in the conventional realm, they're going to have specific numbers. In the integrative realm, we don't have all specific numbers because every patient is treated differently.
Yeah.
We don't treat someone as just one person. Okay, this person has prostate cancer. We treat them the exact same. Again, we're looking at what is the cause of that and modifying their diet, nutrition, and formulating treatment protocols around that specific condition.
You know, I will say this, being actively in chemotherapy right now and feeling amazing because of my integrative regime. Like I do, I lift weights every day. I take a walk every day. I could even jog if I wanted to. In fact, my like laziness with working out has less to do with my dying cancer and has more to do with me just being a lazy dude. You know, it's like, I don't want to go and work out today, but I can, and I do, and I feel great. I will say this, when I go into chemotherapy, it is not a happy place to be. The people there do not look or act in any way happy. And I do try to take a little bit of pep in my step there because I do want to sort of be a light in that place. When I go into your office for treatment, and I mentioned this yesterday, we all are having a great time. Like we're chatting together, we're laughing and smiling. And, you know, I'm sitting there with patients who look way better now than they did when they first started. And my experience has been that when you get into the integrative community, you meet less people. Yes, less people, but they're doing way better than any one person in that massive chemotherapy room, which is always filled. And it just breaks my heart that people go to integrative when they're already broken from chemo for years and radiation. Like it's a last ditch effort when I wish it would have been, for us especially, would have been more of the first thing that we tried. So let's talk process as we end the show today. What should a patient do? So there's someone who just got diagnosed, or their dad did, their mom did, their husband did. What should a patient do? Like what's the step or the process you would walk them through to make sure that they're getting the best of both worlds?
I think the best thing you could do is really to go to an integrative doctor first. The reason why I say that is they're not going to bash conventional medicine at all. They're going to talk about what is the best options. Let's talk about some of the studies behind that. Talk about what's the benefit of the chemo and radiation. What's the benefit of doing the herbs, the nutrients, or the IV procedures, or whatever we're going to do there. And they're going to talk to you and let you know what type of questions to ask your conventional doc too, about like, okay, what are your success rates with the chemotherapy? What's the process that's going to be involved? What are the specific side effects that are going to be involved? And then there's many other questions to ask that I give my patients to ask their conventional oncologist if they come into me before going to their oncologist. Because if you go to the conventional doctor first, they're just going to tell you one option. That's it.
Yeah.
And you just do what I say. And if they're not open-minded and really have researched into other things, they're going to be like, there's nothing else that works. This is the only thing that works.
Yep.
And then you could ask them about various modalities and they don't have any idea what you're talking about.
Yeah.
Because they haven't researched it. Like I said, they researched their region, chemo, radiation, surgery. They don't go outside that box. A conventional oncologist, it does not mean they know everything cancer. It means they know everything about the specific therapies they do.
Yeah. And, they'll say, eat whatever you want. We've actually run into issues where my oncologist wants me not doing certain things and like supplements, she's like, I don't want you taking these supplements anymore because we want the chemotherapy to work. And we had to make our own decision to continue doing the supplements while on chemotherapy. And we've been able to shrink our tumors. My tumor's 30%. And I'm well on the way to remission. Like it's right. I'm knocking on the door to remission, folks. It's right down the way. And they might even try to distract you from taking an integrative approach. And so, it's very important that you build a team around you when you have cancer or someone has cancer, is that you've got an integrative, you've got your oncologist, and you might even have a nutritionist. And that's what I love about Dr. Jake's organization is they've got a nutritionist in the house who provides tons of great advice on high-fat diets and things of that. And if you or someone has been diagnosed with cancer or even an autoimmune disorder, be sure to go to integrativemedica.com and speak with one of their doctors today and get an opinion. Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, MEDICA.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.